Hi, my name is Maxine Richards, RN to BSN student at Cedar Crest College. This research is based on finding out the effectiveness of registered nurse case management in preventing hospitalization in patients with chronic diseases. Three of the diseases focused on in the research that I did is chronic systolic heart failure, chronic obstructive pulmonary disease, and diabetes mellitus. Some background on this is that Medicare is now imposing fines on hospitals with high rate of preventable rehospitalization. Also, the Affordable Care Act triggered nationwide it shows the high rate of readmission that was preventable. So hospitals and other healthcare institutions are now looking for ways that could prevent these hospitalization in order to avoid these fines. The objective of the research was to find out if registered nurse case management intervention prevent rehospitalization, and it also looked at the quality of life for the patients with these types of diseases. The evidence synthesis was based on 3 articles research. One article was a randomized control study. Another is a Cochrane review, systematic review from the Cochrane Library. Another one also looked at program that was developed by registered nurse case management in preventing rehospitalization. And in all 3 articles, it shows that registered nurse case management over all other intervention have the highest rate of preventing rehospitalization. The Cochrane review, systematic review, looked at 25 research that was done based on finding out this answer, and it also come to a conclusion that there was 3 aspects looked at, and it was into multiple disciplinary intervention, clinic intervention, and nurse case management intervention. And it shows that nurse case management intervention have the highest rate in preventing hospitalization, also the highest quality in obtaining better quality of life. Now, the nurse case managers have different aspects that they looked at and that they help the patient with achieving, and these are activity of daily living, medication reconciliation, their diets, and other things. They looked at a multidimensional aspect of the patient and are able to do the plan of care to cover these aspects of the patient's daily care. Now, the review also showed that nurse case management intervention help patients to achieve a higher quality of life. It also shows how nurse case management intervention are more cost effective. Most of the programs that nurse case managers develop are telephone based, and it can reach patients at a wider range, patients who would not be able, other intervention or nurse case management would not be able to go to those patients' home. So they use telephone monitoring to do on a weekly or daily basis based on their protocol to reach the patient. This way they can keep in touch, and patient can continue to update them on their status, and they can continue to educate patient on what to do in case they have adverse side effect or adverse signs and symptoms of their disease. The recommendation is that registered nurse case management intervention are effective and can be utilized in our everyday practices in today. So hospitals and other healthcare entities have the ability to use this type of program or these types of programs developed by nurse case managers to cut costs and to provide a better service and better outcome for their patients with chronic diseases. And these are the references for the research, and thank you for listening to my presentation.